Hello, ladies and gentlemen, and welcome back to another episode of The Grateful Show. Today, as always, you have here Pascu and Bogdan. What are you grateful for, Pascu?
First and foremost, this is, I think, the first time we are actually making a podcast remotely because we are usually used to make them together. To be honest, I'm grateful for the fact that we can still do the podcast without seeing each other, like physically. I think it's a thing to be grateful for.
Yeah, we are just getting ready for the second wave of quarantine or whatever they say.
Yeah.
And basically we thought, because we were triggered, that's why we thought that we should make this podcast remotely. So we thought that we should just discuss our opinion publicly about coronavirus, about COVID, or whatever you may call it in your country, because I'm 100% sure that everybody knows already about it. Everybody has been affected about it. We're just going to touch a little bit everything. I mean, from the beginning to this current situation, to the future plans. We have done one of these podcasts before, but it was more, how can you call it? It was discussed in such a manner that it's not going to necessarily affect the public's opinion.
Yeah.
So we were more gentle.
Yeah, I like this one.
Yeah. So do you want to begin?
Yeah, I don't mind actually. Well, I think first and foremost is worth mentioning, as you said, like putting things into perspective, just to like remind people where it all started from. Like, as far as we are aware, like this is what we've been told at least, the whole virus started in Wuhan in China, right? And this was roughly beginning of December 2019. Slowly but surely it started spreading, and I'm not sure whether people are aware or not. I came across this information quite recent, how the Chinese media started portraying this so dangerous virus. First and foremost, they started faking people's deaths on the streets. Like in public, there were people falling on the ground and they were recorded. And there is footage, I think there's still footage on YouTube from Wuhan with people actually dead on the floor. Why? Well, first and foremost, let's all remember that China is a communist country. The rights of the public are very reserved, very limited. And this strategy, if you want to call it that way, was mainly instigated in order to provoke fear. Like straight away, when you would see people falling on the ground, you will think like, oh shit, this is serious. Like this is not just another flu. This is not just another lie of the government.
So there were people falling on the ground.
Yeah.
I mean, in this current situation, like in the present moment, if you're going to tell someone that I know someone that died of coronavirus, they just felt on the street, they would be like, but it's not working that way. You got to go into a hospital, you got to cough. It's not that way.
Yeah,
I mean,
you need symptoms. Yeah. And slowly but surely what happened is obviously, why did it start in China? Now, this is not my opinion. Again, this has been, I guess, guessed by other people that are interested in a subject and are actually looking to find the truth. They said, well, first and foremost, Wuhan is known to be C3 of China, whose population is very elder. Therefore, people are more intended to take any type of virus, let alone this type of virus. And also because of the air pollution. And last, and the most important factor is the fact that it's communism. So giving laws there that would limit people's freedom would be much easier than giving those laws in the first place in the United States or in
not like it's wrong, like communism is wrong. Of course, like every type of structure of the government, it's good in a way and bad in another way. So it's not just because of the communism, but like Pascu said, it is because like it's easier for them to implement some rules and to force people to do something because this is how they are used to do things.
Yeah, and then China was seen as a model by the Western countries. And then it all started, like the huge cases started spiking in Italy, in Lombardy area, where again the air pollution is known for a fact to be huge. And also Italy's overall population is very elder. I think, don't quote me on this, I think they have the eldest population in the Europe. If not, they are definitely top three. And again, that's why it continued in Italy. And from there started to be a lot of rumors and footage of people dying in hospitals, of hospitals being full. Again, that footage has been proved to be fake. That footage was either not actual, like at that time of the year, or it was all just premeditated.
It's funny because I've seen footage with people like with a lot of dead bodies, like packed into these bags, like all on top of one another. So there were like hundreds. And I've also, in the same period, seen people like medics, doctors talking and just walking with a camera into the hospital and just saying, guys, I mean, there's nobody here.
Yeah.
There are just this section with the coronavirus, which is not that big. We only have like, I don't know, a couple of tens of patients and then nothing. I mean, everybody was just working for corona and there were no deaths, no nothing. So what should you believe in? I mean, I remember that these two cases were both in New York. So it doesn't really make sense if one of them was in New York and the other one like in a country where the numbers were lower. I mean, it would make sense, but coming from the same city.
Yeah, it happened in Germany as well. Again, I'm not sure whether he was a vlogger or just a normal guy. Went, one of the most well-known hospitals. I don't remember the city exactly, but literally he broke in. He was not allowed. He started filming and he was like, look, there's no one here. And literally 20 minutes ago or 30 minutes ago, they were taking an interview from the front of the hospital, telling people at the news about how full the hospital is and like how dangerous the whole situation is because they are running out of like medics and tools and whatever. So those are just a few glimpses of what is actually and what was actually going on at a time back then. And then we have to analyze like how it all started. Like I think best example is to like use our own life experiences. We were back in London, back in the UK. And I know London and like the UK have been a bit slow at taking responsibilities with like the restrictions and everything. But like after they did so, the whole purpose was to flatten the curve. That's what the prime minister was telling people. We are just trying to flatten the curve. It's going to be roughly between 4 and 6 weeks. So we can save the NHS because we are running out of stuff. We are running out of hospital beds. Once the curve is flattened, there will be no more restrictions. We will actually be able to like find a cure and whatever. It will be all good from then.
And then 3-4 months later, if you remember that gathering we had with our friend Vittorio, and his friend who was working in, she said that hospital was the most, not necessarily affected. So almost all the patients were coming in that hospital. And she was saying that there are not really that many like people affected. I mean, she's working there and she has to be there, but they're not like as bad as the media and the news are portraying to be.
I think it's worth mentioning to people like I personally don't agree with the fact that this whole virus doesn't exist by no means. All I'm saying is that first and foremost, majority of people that unfortunately are dying of this virus, probably 99% of them are already suffering of other affections. They either have respiratory diseases, they have diabetes, they have other health problems, health issues that they've encountered. And I was reading some article yesterday, actually, from our country, from Romania, and they were saying about Ploiești, one of the cities here, being full. Like people have to wait about 72 hours to get treated for like real problems. I'm talking about like diabetes, I'm talking about cancer, whatever you think it's like.
Maybe a broken bone. I mean, come on, let's be honest. I mean, there are people who are really suffering, not just like this completely big lie. I mean, you're coughing and you're just have like special treatment because you're coughing and because you may think that this is like very dangerous, whilst in fact it's not. And a lot of people are actually just having maybe SIDA or HIV or maybe, I don't know, a lot of other problems, even cancer.
Now, let's talk a bit about the actual restrictions, because I think this is why most of us are a bit upset or a bit more. And I'm going to quote a few paragraphs from a group. I mean, I'm not going to give any names, but basically it's just pure reasoning and arguments to anybody's arguments against them. Basically, a ship is asking, why aren't you wearing a mask? Answer, because nobody here is ill, and besides, they don't work. Okay, you're mad. This virus is very deadly. Not really. The infection to death rate is 0.004% if you're under 70 and 0.026% if you add the over 70s. But it killed a lot of people in Wuhan, what I was mentioning earlier. Well, Wuhan has an elderly population full of respiratory problems and terrible air pollution. Perfect place to declare a new pandemic, plenty of scope to redesignate case and deaths. I'm going to skip forward, but I saw videos of people really ill in hospital. The footage was proven to be fake. But after the lockdown, cases in China plummeted. Very convenient that the first lockdown happened in a communist country where people have no rights and could then be presented to us as a success. But the World Health Organization declared the pandemic. Of course, the same organization has massive financial ties to Bill Gates, China, and Big Pharma. How about the computer models that said we were all going to die? And I think this is referred to like the predictions that London, Imperial College of London has made back in March about how if Boris Johnson is not going to get like a real restriction, 1.5 million people were like predicted to die in the UK by the end of the year, 1.5 million. Well, again, the models were produced by colleges funded by the one and only Bill Gates. They have got it wrong every single time, but on purpose. Okay, says the ship, but that's because the lockdowns saved us all. No, they didn't actually. Look at Japan. They had no lockdown. They have double the population of the UK, 122 million living in densely packed cities. They have had just over 1,000 deaths. And I'm going to actually refer to Sweden. And I'm going to talk about deaths because I really don't care about the cases no more. I'm only talking about deaths. And I'm looking on like Google data at the moment. And in the past month, as in October, there were roughly about 20 to 25 deaths in the whole Sweden declared to be died because of the virus.
And you know why? I mean, it's just, if you really put the pieces together, it's because, like, let's talk about here in Romania first.
Yeah.
I mean, I believe that the total number is just like somewhere above 6,000, right? Since everything began.
Yeah.
So from 6,000, I mean, I have a lot of friends. I mean, I've heard a lot of rumors, and not just rumors. I mean, there are people who I know, and they've been affected by this shit. And like their relative died. Their relative just died. I mean, they had, I don't know, like cancer or anything else. And basically they were forced by the government to say that, I mean, their death was caused by the coronavirus.
I know of other people that were not forced, but they were asked if they want to get 1,000 euros in order to declare that they died suffering by that. And again, that doesn't mean that they died because of the virus. No, they died having the virus.
Exactly.
It's like somebody gets hit by a car and you say that that person had flu. Okay, so what? They got hit by a car. That's why they died. Yeah, but they had flu. We better just add more deaths to the flu because he had flu.
Exactly. and I think what Sweden did is they actually gave the correct number of people who actually died of coronavirus. I mean, they really had a respiratory problem, and it's caused by the actual virus. It was caused by the actual virus. And that was the real number. So if we're really going to put the things in perspective, I mean, 26 or whatever much you said there was, like if you just count up all the cases, like from the real deaths, you would just add around like maybe 500 deaths in a year per country. So 500 deaths is just like
last week
people die of anything.
Yeah, last week the UK has ordered closing of the gyms. There was a huge battle in the fitness industry trying to like keep the gyms open. And as far as I noticed last night, apparently Liverpool Council has got the approved from government to keep the gyms open. I think it's just Liverpool at the moment. Probably they are fighting for the whole northern region of the UK. So they've been able to do that. I'm very surprised they managed. But like last week, when they actually gave this new restriction, I was watching Brian Rose on London Real live stream, and he was showing like real numbers about how in London on that Wednesday or Thursday was last week, there were 3 deaths of coronavirus in 9 million people. That's a population of 9 million people in the whole Greater London, and 3 people died of the virus. And they are deciding to close hospitalities. That means about 200,000 people left without jobs, people that are working in the hospitality. Now think about those families and think about those people that are going to be in debt, and think about their mental health, and literally think about their future, really, because they might just get depression and like commit suicide, or like start abusing drugs, or like the impact is much more greater than just a few deaths that are like announced to be because of the virus. And let's not talk about like the current stage in which every country from Europe, even the USA, in how much debt every country currently is. I was reading yesterday that the UK has bought 30 million vaccines that are predicted to arrive late November, the latest in the UK. That's 30 million vaccines. I don't know the exact sum of money, but there's definitely a lot of money to be paid for those vaccines. And people are like, yes, but they are paid by the government, because people have no financial education and they do not realize how those money are going to be paid back through taxpayers, through you going to your job, through inflation, to like price raises in petrol and all the other stuff. Like it has such a huge impact. Like it's not really all just about a mask and like a couple of deaths here and there. It's the whole economic structure that is falling apart because of it. And this
it's
is
funny
the
because
problem.
they make the money. Like these are the people who are making the money.
Of course.
And again, these are the people that are in debt. So how can you like provide something and in the same time don't have it? It's just like me having a car company and producing cars, but at the same time, I'm just complaining that I have to take the bus because I don't have any cars. And I'm the owner of a very big car company. I mean, it doesn't make any sense, does it?
Not really.
Yeah, and it's very funny because, I mean, don't get me wrong. I was maybe in your position if you still believe in the coronavirus. We were both. I mean, I believe almost everybody was in the position at the beginning to believe that it's actually something, because you can't just deny everything from the beginning, because it may really be a very big threat. And of course, you had all the reasons to be afraid and to just follow what the government told you, because you had no time to think for yourself. I mean, everything was given to you, and because everyone was just panicking, it was normal for yourself to act according to everybody else's behavior, because if it really was a threat, you would just die or just be extremely bad affected. But let's remember that during the lockdown situation, almost everybody was left alone with their thoughts. So then you just had the time to reflect about your life, about what happened, about what is happening, about what's going to happen. You had the time to actually just take a piece of paper and just analyze everything from your brain. You didn't have to follow everybody else's opinion and like the government's opinion. Of course, the government is trying in most of the cases to provide us with the best things, but in some cases when they're just trying to actually change something for their favor, you got to put yourself some questions, and you got to ask yourself like some questions all the time, because back then you didn't have any like excuse, you didn't have any reason to think for yourself. But now, I mean, you are responsible for what's happening. And I'm sorry to tell you, but if you still believe, just take some time and just consider whatever we are saying, or whether about like what all these people are saying, that there might be just like a very big conspiracy theory.
The problem with people is, I think, and I was mentioning a lot of stuff on my Instagram story yesterday, I'm not sure whether that's very effective, if it's a good idea. But I just had the urge. I was like, I can't just be sitting here and not telling my honest opinion and thoughts. And like the problem with people is, I'm not asking anyone to believe anything. The only thing that I'm asking you is to actually take a logical decision and have your own choice rather than just choose to believe whatever the fuck the media is telling you to believe. Because if the media is telling you that tobacco is good and like alcohol is good, what are you going to do? Just believe them and just consume tobacco and like drink alcohol? Why do you think those things are legal? Because they're healthy for you? Let's be honest. Like, is it really about health or is it really about other interests such as money? Like if the tobaccos were really not producing money and they were this threatening to so many lives, do you think that they would still be legal? Of course not. But there are other
Exactly.
interests. Like you have to like see the big picture, follow the money. Where are the money?
And of course that everybody's gonna think that they are the best and they have their opinion, it's
Yeah.
right, because this is how we as people, our
Yeah.
human behavior is like portrayed to be. But just let for a second your ego aside and just like ask yourself some questions. Just fucking ask yourself question every time you hear some news or some opinions. Don't let like anything that goes around just influence you and your thoughts. I mean, I was just talking to someone about, I believe 3 days ago. I was going in a gym, and basically here, I don't know in your country, but here in Romania, in the capital, in Bucharest, basically everywhere, you have to wear the mask, not inside the gym, like while you are training, but you gotta wear your mask at the reception. You gotta wear the mask like in the changing room. You gotta wear the mask everywhere, but inside the gym where you are training. And I was just like climbing the stairs, and there was this PT coming to me. I wasn't wearing a mask, just at the reception because, yeah, why not? And he was telling me, you know, bro, you have to wear the mask everywhere, but in the training area. And I'm like, but how? Doesn't make any sense, right? I'm here. The training area is like 2 meters away from here. Those people are not wearing masks, and here we have to wear it. It doesn't make any sense, right? Yeah, but these are the rules. Yeah, but you have to do it. And I'm like, okay, so if the government is coming with a law and just gonna tell you that you have to walk like in your
Crawl.
knees,
Yeah.
just to crawl, are you gonna do it? And he was like, yeah, of course I'm gonna do it. If this is the law, I'm gonna do it. Like obviously the conversation just ended there, but it's just stupid how people like don't use their brains
No, they
at
don't.
all. It's just like, I'm just surprised, honestly.
Yeah. Yeah. I was having a conversation with someone, I'm not going to give names, recently. And I was telling them about how I haven't been eating sugar in the last almost 30 days because I'm just trying to like not eat sugar at all. And it's been great, actually. I'm feeling amazing. And they were like, hold on, but you know that sugar is like useful for your brain, right? And I was like, you're joking. No, no, no. Like it's very good for your brains. And I was like, are you talking about like the sugar that you're getting from sweets? He was like, yeah, it's good for your brain. Like chocolate is good for your brain. I was like, oh hold on. Let me just write on Google. Is artificial sugar good or bad for the brain? First article, it literally gives you all the reasons why it can cause inflammation, it can cause brain damage, like obviously in big quantities, but we are talking about the fact that it was good. That's what this person believed. And this goes to show like such a basic information that could be easily searched online, it's believed to like be the other way around. And like this is very easily verifiable. But like if you're trying to actually look for like information in regards to what is actually going on at the moment, I'm not sure how many of the people listening are aware of this, but most of the information out there is censored. Like you cannot seek the truth. It's very hard, especially through searching engines such as Google. Like you can't, you literally cannot find,
Especially
even if
about
they're
coronavirus, you can't, because if you're going to type anything, basically all the articles, everybody who is giving the 99% the right opinion is just going to be censored because they don't want you to actually hear the truth about everything. So obviously you don't have to go and just to research every single small task that you have to do in your day, like how to wipe my ass. I mean, you don't have to do like everything, but about the big picture, about the things that are really affecting you, you got to just put yourself some questions, isn't it?
Yeah, and like I want to laugh a little bit. Do you remember? I was just testing it now. It seems that it's not working anymore. But do you remember back in June, there was this thing, it lasted for a couple of weeks. No matter what number you would write in Google, just think of a random number. It could be thousands, tens of thousands. If you write that number in Google, there would be articles telling you that that amount of new people have been tested positive by corona. There were that many cases, like no matter what number you would type, and tell me that that is like true and that is real and that is actually going on. Like, what are the chances of? I literally do remember that we were inputting like number after number after number, and there were articles for every single
Yeah, I remember
number.
you told me, and I'm like, no, bro, you're crazy. This can't happen. And then I was shocked. I spent like at least 15 minutes doing that because I was amazed how I could just write any number and then it was corona related.
It's not working anymore. I think they figure out it's just nonsense and it's working against their plan. But yeah, the problem, to be honest, like it's not the current situation. But I want to tell people, like, look back in March, how everything was portrayed back in March and how serious everything was back then, how serious things are now, how everything has changed in within 8 months, how it's now very normal to like stay isolated, like it's the new normal. And like look at what is going to happen, because sooner or later, within a couple of months, they will release the vaccines. And at first, they won't be mandatory. Like, I personally don't want to take it, but they're not going to oblige you. They're not going to force you. What they're going to do, they're going to impose restrictions. They started with the masks. Now they are going to, like, literally, there was an exercise. They were like, try to change the word mask with vaccine, give it another couple of months or years, and then instead of vaccines, put chips. And like, it's the whole sentence, like, you're not allowed to go here without a mask. You're not allowed to go here without a vaccine. This is literally how the whole pandemic is going to like
they're just trying to control you. They're just trying to get more and more information so you can be under their control. And it's happening right now.
Yeah.
And we only spoke about like the problems, and we only in this podcast we only spoke about the problems, we complained, but the solution is you being more aware about what is going on around you. Just use your goddamn brain. I mean, just put all the things together and realize that it's not a threat. Just trust like this thing, and just don't wear a mask for a couple of, I don't know, weeks, and see if something bad is gonna happen to you. Nothing bad is gonna happen. Nothing. And you're gonna be just surrounded with this information. You're gonna realize that it's just a lie. And we are all headed in a direction, like Pascu said, where you're gonna be forced to just be controlled by vaccines and chips. You're not gonna be allowed to leave your country or maybe to buy food if you don't have the vaccine, if you don't have a chip.
And again, you might be saying, but I'm healthy, I don't want to take it, like I don't need it. Again, they're going to play the same game on you. They're going to be like, it's not about you. It's about the people that might be affected. It's about the transmission. You're not wearing the mask because you might be unhealthy or ill. No, you're wearing the mask because you have to care about other people and save lives. It's going to be the same narrative, but this time it's going to be with vaccines. And I'm not sure how many of people listening are actually willing to take the vaccines. I'm personally not willing to take it. And I'm willing to like go very far and beyond and say that I might even not want to leave my house for a while if that's implemented. Like, it's literally horrendous. Like, I cannot even think about the reality that way. And it's very sad. And let's say that we cannot do anything about this whole global plan that, by the way, has been planned since 1984. Search for 1984 and see what happened then. I'm not going to go into much detail, but let's say that we cannot do anything and we cannot change the system. At least the only least thing we can do is, like, as you said, be aware, notice that there's no threat, and like try to not be afraid of anything, because when you're afraid, you are lowering your vibrations, your energy field is damaged. You are damaging your relationships, you are damaging your life choices, you are operating from a place of fear rather than operating from a place of abundance. And that goes and applies financially, relationships wise, everything wise. Like your whole life is going to be affected and predicated upon fear rather than positive things.
Exactly. Just take a moment and ask yourself, how many people do you know that are happy and that are open-minded and just live a life however they want, and they're ill? Maybe just a few cases, but I mean, almost nobody. Is the case that if you are negative and you are surrounded by the bad habits and all this negative thinking, you will have this disease because it's easy for them to control you. This is what they've been doing like forever. And nobody is telling you now just to go on the street without a mask and just go to the police and just tell them, fuck you, I'm not going to do this or that, because that's just stupid. You're just going to like put yourself into trouble. But just try to spread this information, this like the real news.
It starts with you, and like it's very selfish to like take this decision that has been taken by the government as being your own, because it's not going to be just your life and yourself that are going to be affected. It's going to be all the people around you. Exactly. And like I was reading something the other day, and it was like, we can still be friends even though we don't agree on certain things. And I completely agree with that. And I don't expect anybody listening to agree with my point of view. All I'm saying is try to, as again, we're going to repeat ourselves, try to take the decisions by yourself. Don't let the media, government, and no other regulations, rules, or whatever crap dictate what you are thinking, what you're believing. Try to like seek to understand from all angles. And also like there's so much information out there. You just have to like take the time and have an open mind and want to watch those interviews with David Icke on London Real, and want to watch documentaries about the Hollywood, about the pedophiles around Hollywood, around child trafficking, around, I'm not going to go into much conspiracy subjects, but like there's whole new world out there once you actually realize that what you've been told, it's mostly lies. And it's a very hard pill to swallow. Like I remember back in March, it's taken me about 2 months till May to properly digest all the new information and points of view and like accept it, because it's very, very hard. You have to like literally step up on your ego and be like, okay, I might have been wrong in this, with this occasion. I might have had a bad opinion. This might have not been the truth, might have been a lie. Therefore, I can pivot now and like understand for myself, and then share these new thoughts, views, and energies really with other people around me. Because at the end of the day, that's all we can do as individuals, as normal people. If they're censoring everything online, the only thing you can do is just make sure that the close people in your life actually do know what is actually going on, and they are not operating from a place of fear.
Yeah. And with that being said, we're not going to keep this for any longer. We just shared and tried to share as much insight as we could for yourself to just, like Pascu said, be more open. And
I'm going to actually, sorry to interrupt, I'm going to actually leave a few links for the people that are really looking and seeking new information. I'm going to leave a few links to a couple of interviews and a couple of resources that you can start with.
Yeah. And with that being said, thank you so much for listening. We are not forcing you to just take our opinion. Just like take it with a grain of salt and just think for yourself and just like analyze everything. And until next time, thank you so much for listening. This is Bogdan.
This is Pascu, and you guys stay grateful and more aware, hopefully.